Namaste. Myself Dr. Vikram Singh Rathore. I am an aesthetic plastic surgeon working in the city of Kolkata. Today let's understand which every woman should know before she decides to undergo breast implant surgery. How the design of breast implant can make its feel, its longevity and the shape. Let us decode what is inside the implant and why the same size of implant can makes two women look different. Every breast implant is having an outer covering which we call it as a shell. These shells are of two types: smooth shell, which feels soft and moves freely. Textured shell are more stable and they have a good grip. But these textured shells are now used very less because of the safety reasons. Nowadays we are having a nano textured shell implant also, which are used very widely. When my patient asks me which one should I use, my decision is based on three factors. The first is the pinch of the breast tissue. There should be adequate breast tissue between the thumb and the index finger, especially at the upper pole. Then the elasticity of the breast tissue, plus how is the quality of the skin, and most importantly, what is the patient's profession. If the patient is constantly engaged in a gym or a athlete, why these things are important, so that the result of breast implant looks natural and it should be safe. Now, what is inside the implant? There is filling. This filling is of three types. Number one is cohesive silicone gel. This gives a very natural, soft appearance and it maintains its shape even if it breaks or cuts. So we call it as a gummy bear implant. Number two is saline implants. As the name implies, it contains sterile normal saline. But the problem is that the feel is bit unnatural and it may cause ripples. So that's why the saline implant is not used very frequently, bearing few indications. So long-term studies suggest that silicone cohesive gel implant gives a very natural feel and they are safe and long lasting. That's why you can say they are the best. Now let's discuss about projection. Projection means how far the breast comes out forward when the implant is placed inside the breast. Sometimes projection, often the surgeons says, or profile. So depending upon the projection, it could be a small projection or small profile, moderate projection or moderate profile, high projection or high profile, or extra high projection or extra high profile implants. Let's understand in detail. Low projection means wider and subtle look. Moderate projection means balanced and natural look. High projection means fuller and more cleavage. Extra high projection means maximum forward fullness. Many patients says Doctor, I want 350cc implant. My friend has undergone a 350cc implant and it looks perfect on her. But the truth is that same implant size will not produce or look like a same look in two different women because it depends upon variety of factors. Chest width, original breast size, quality of the skin, as well as the breast pinch in the superior pole. So all these factors are very important, which will give the real result by a breast implant. So implant selection is not a number. It is about matching your own body proportions. After doing this, all these parameters I assess, then I decide which size of implant, which projection of implant, and what type of implant I have to use so that the results look more natural and with a very good feel. And patient should feel that it's giving her a very natural look which she's desiring of. Sometimes, often I show a implant catalog to the patient, and my patient points, doctor, I want this implant or this shape. Then I say, deciding on the above parameters which I have examined in the patient, I say, I will be choosing an implant which will matches your body. And this is how it's going to give a natural and long lasting result. Let's discuss about the shape of implant. The implant shapes are of two types, round implant and the anatomical shape or a teardrop design. Coming to the round implant, it is most commonly used. It gives a upper pole fullness, more youthful appearance and a lifted appearance. And it is desirable to the patients who wants a very visible cleavage. So these implants are very high in demand and most commonly used. Now second one is a teardrop shape or a anatomical implants. So these implants are typically of suits with the human anatomy, means it is heavier or broader at the base and tapering at the upper pole. So there are some patients who wants a very softer and a subtle look and more anatomical type. So it all depends upon the patient's chest shape and the patient desire which implant they are looking for. Typically, the anatomical implant is used in a patients who have undergone a mastectomy surgery for a cancer of the breast and the upper pole or the muscle is also absent. So they may are looking for an anatomical shape of the breast, or there are some patients who really wants that shape only. So both anatomical as well as the round shape implants are good, but it is being decided by the patient's anatomy and the patient's desire, what the patient is looking for. Now let's discuss the last parameter is the size of implant. The implant size ranges from 185cc to 800cc implants. Smaller implants gives a subtle appearance, larger implant gives more curves. The best is being decided by the patient's anatomy and the patient desires, and after examination by the surgeon, the parameters which already I have discussed. As per USA FDA, till 800cc silicone implants are FDA approved. But there are some companies who are having a range of implants maybe from 940 to 1445 cc. But in my opinion, very big implants gives a really unnatural look. But if the patient desires, then who can stop them? So, in a nutshell, it's not about the size, small or big. It is about the balance and proportions, because that is going to provide you a very natural look.